institution needs to understand physical risk to the institution, the vulnerability of its patient populations that it serves, and how some of those environmental hazards are affecting them and will in the future. So doing vulnerability assessments and adaptation analyses is really important. There's good methodology on how to do that at a healthcare system level. In addition, I think we need a lot of proactive work in research and in the implementation of healthcare to deliver interventions to address those risks.
We at Boston Children's Hospital are seeing a lot of impacts on our patients, their families already. One that often comes to mind is with summer coming up is the effect of extreme heat, both in terms of the normal impacts that you would expect in terms of dehydration and heat exhaustion, but also thinking about impacts on kids' behavioral health, on those who are on medications that might be less effective in extreme heat situations, as well as kids whose families perhaps have trouble with keeping their medications cold, people who are getting their medications delivered and maybe they're sitting outside. So for a variety of different conditions, maybe not having their medications be as effective in those situations.
We also see an uptick in seasonal allergy in terms of the acuity of it and the duration of an allergic flare-up for children. When we also think about schools and the learning context related to what Kate said around an increase in heat-related stressors in the public schools, there is actual learning loss happening for kids in terms of, having high heat days when it's not possible for them to be in the school building and having to cancel school for those days because we have very old schools here in Boston. Many of them lack central heating and cooling systems.